this is my inspection of the thorax. I'm inspecting the anterior thorax for chest configuration, any deformities or asymmetry, the work of breathing, the use of any accessory muscles, retractions, and any impairment in the respiratory movements. Then I'm going to do the same thing posteriorly, looking at the same things. And then I'm going to ask you to inhale and exhale. And that's looking for rise and fall of the chest, for asymmetry, which she has. So there is no abnormalities noted on inspection. Now I'm going to do palpation. I'm going to feel the chest for any tenderness and palpate for any tactile firmness. Any tenderness?
No.
You say 99?
99. 99.
Any tenderness?
No. 99.
Tenderness?
No.
I'm going to do the same thing posteriorly. Any tenderness?
No.
99.
99.
Again?
99. 99. 99. 99.
No tenderness?
No tenderness.
Okay. And now I'm going to use percussion to detect any pleural effusion, and I'm going to feel for any dullness or hyperresonance sounds. I'm going to do the same thing posteriorly. And there's none noted. Now I'm going to do an auscultation. I'm going to listen for any abnormalities in her breath sounds, any diminished lung sounds, crackles, wheezes, anything like that. Deep breath. Okay. Same thing posterior. Okay. No abnormalities noted. Now I'm going to move on to the cardio inspection. I'm going to look at the patient's skin for color, any cyanosis, varicose veins or JVD edema noted, which is all normal on her. Then I'm going to check the nail bed for the capillary refill, which should be less than 3 seconds, which it is. And then I'm going to verbalize all of my auscultation parts of the cardiac region, which is the aortic, which is the right second intercostal space right of the sternum. And that's the aortic. The pulmonic is the second intercostal space left of the sternum. And tricuspid, the fourth intercostal space left of the sternum. Erb's point, third intercostal space left of the sternum. And then the PMI, which is the point of maximal impulse, the fifth intercostal space, midclavicular line, left of the sternum. And that's all of the inspection. Now I'm going to palpate for the location of the heart, the aortic, the mitral, Erb's point, pulmonic, tricuspids, and I'm going to be palpating for any frills and for the pulses.